Now, there are multiple grades of brain injury. They're all the way from severe to moderate to mild. Severe brain injuries are easy to see. You can actually see them in imaging studies. For example, let's look at this imaging study here. Along the right side of the photograph, we see single arrows. Those single arrows are actually marking the outline of the brain, where they should be up against the white skull you see on the far right. That's actually swelling. It's blood and swelling that's pushing the brain over to the left. You see the double arrows there? You see the line, the vertical line in the middle, kind of extending from the bottom towards the upper left. That's actually the middle area of the brain that should be extending straight across the brain to the double arrow at the top. So you can see just how far over the brain is being pushed as a result of the swelling. Now, it's not always easy to find a brain injury. A lot of times, particularly in the moderate to mild cases, you don't see the changes that we just saw on the imaging studies. But they still have the same results. They still have many of the same symptoms. There can be cognitive issues, difficulty thinking or understanding. There can be physical issues, difficulty moving your body, moving your lips, your mouth, speaking, things of that nature. There can be significant memory issues, both short-term and long-term memory. There can be personality changes. Usually what we see is uncontrolled anger or fits of sadness, severe depression. Or there could be additional changes such as avoidance of others. Some people become suddenly afraid to be around other people, afraid to interact with people. These are all signs of brain injury that aren't necessarily seen in an imaging study. Now, the problem with those types of brain injuries is from the common person, the person doesn't know the person, people that don't know the person that had just been injured. They can seem relatively normal. They look like we do, the rest of us do. They talk, or can talk like the rest of us do. There's no speech pattern differences or disturbances. They tend to react to many of the same stimuli as the rest of us do. So from an attorney's perspective, it's difficult to get a jury to understand in a 3 or 4 day trial in particular, when they don't really know that person, don't know their history, don't know what type of person they were coming into the accident, to understand the gravity of the changes that were made, the gravity of the changes that were caused by this brain injury, particularly where you have an MRI or a CT scan that doesn't show the obvious brain injury we saw earlier. The pushing of the brain to one side, or the swelling or the bleeding in the brain. You can't see that. It doesn't mean that the brain itself isn't injured. You just can't see that. So some jurors tend to believe they have to take it on faith that the person is in fact injured, and that can be a tough sell. Many jurors are skeptical, so it can be a difficult case indeed.